Hey, Mary, how you doing? Thanks for joining us today.
Happy to be here, Mel.
No stranger to most of us, Mary Furlong is a visionary leader with decades of experience in the boomer and senior market. In 1986, Mary founded SeniorNet, the first social network for older adults, and Third Age Media, acquired by Ancestry.com. Mary went on to establish Mary Furlong and Associates, a marketing and consulting firm. Mary has received top leadership awards from the American Society on Aging and was named one of the 100 most influential women in Silicon Valley. Mary is also an annual co-producer of this summit, dating back to our first in-person one 5 years ago, which we called What's Next Canada, along with Mary's What's Next series of conferences. Mary's joining us today to share her thoughts and expertise about our showcase of some of the top applicants of our latest cohort of our Mentorship, Capital, and Continuation Program, or as we call it, MC Squared. Welcome, Mary, and please tell us what's going on at Mary Furlong and Associates.
Well, it's an exciting time in Silicon Valley, isn't it? And we're excited to be here today. We're producing our upcoming Longevity Venture Summit, which is now in its 20th year. So we've given away over $200,000 in prize money, and it's exciting to see those companies grow. I was so impressed by your latest cohort of finalists of MC2 companies. Very, very impressive. So in addition to the great acceleration services that CABI provides, how much funding are we talking about? And when will they learn if the applications are successful? CABI's been an amazing partner to companies around the world.
Thank you, Mary. In MC Squared Capital, each participating company may receive an investment of up to $400,000 from CABI. Plus, eligible companies may access additional investment of up to $400,000 from the Ontario Brain Institute, OBI, one of our sponsors of this summit. An additional up to $150,000 from Grey Hill Capital Partners, a VC company that's a new partner with us in this MC Squared program. And also they may receive business financing from Clearco, as we have offered in the past too. So companies can access additional investment opportunities through CABI's venture community on top of that. So there's a lot of coin up for grabs here, Mary. And successful companies will be notified mid-April, and work will get underway in early May.
Right. We've both seen a rise in the number of longevity funds that have come to the table from Israel to across the US, and funds in the social, corporate, and social impact space. How much did the pandemic influence this?
Oh, I was going to ask you the same question, Mary, but you're right. There's been a lot of changes over the last couple of years. We've seen a lot of focus on things like social isolation being a key area of focus. It's something we had identified as an area of interest long before COVID, but it's really come to the forefront for a lot of people afterwards. So that's one area. I don't know, are there any other areas that you're seeing, Mary, that you feel have been influenced by the pandemic?
Well, I think there's been certainly that. Those of us who've worked in the field of longevity and aging knew at its core, loneliness is a big issue, but the COVID brought that issue to the forefront. I would say telehealth and telemedicine, huge advances in that area, and also in digital learning. Get Set Up, for example, just how fast they've been growing. So there's a new report by Ziegler on the growth in telehealth. So I think that we see innovation. And I would say another category, which I saw in the finalists, is mental health and people paying attention to their own social and emotional needs.
Absolutely. Thank you for that, Mary. We're going to circle back after we show this showcase to our audience to provide some commentary on our impressions of the MC Squared applicants. And to the audience, after you watch these videos, you will be able to vote for the People's Choice Award for your favorite age tech solution. The winner by your vote will receive an award of $1,000 sponsored by AgeWell, and of course, bragging rights. The winner will be announced in our closing ceremonies at the end of our summit today, so take notes and get ready to vote.
Well, I've got my popcorn ready. Let's watch some videos.
Absolutely.
CareDaily is a B2B AI SaaS company. We lower the cost of healthcare for large insurance providers with our AI and IoT platform because we help seniors live safely in their own homes while uncovering hidden health problems and connecting stakeholders. Our patented AI caregiver has already learned hundreds of jobs and cares daily for people, places, and things. Simply sprinkle a few sensors around the home, and our AI caregivers will privately analyze lifestyle patterns to create wellness scores and insights that can be shared with healthcare providers and dramatically improve the quality of care. CareDaily has a focus on serving diverse and underserved populations. Our product has been translated into Spanish, and we've created a version that targets rural populations where high-quality healthcare may be more difficult to obtain. I'm David Moss, co-founder and CEO of CareDaily. I'm one of the inventors of our AI caregiver services. With our research partners at UC Berkeley, we have published remarkable scientific evidence that our product is uniquely proven to significantly reduce anxiety and protect sleep quality in caregivers of people with dementia and Alzheimer's.
Introducing Delphi MD, the forefront of clinical neurodiagnosis. 90% of strokes and 35% of dementias are preventable or treatable if detected early enough. The problem remains late diagnosis. What if they could be detected just in time? Well, now we can with Delphi MD. Recognized by the FDA as a breakthrough designated medical device, Delphi MD is the first clinically available and effective tool for the detection of life-threatening and irreversible brain disorders. Delphi MD directly probes specific brain networks, utilizing the cutting-edge, safe technology of focused magnetic stimulation, and determines brain health in a direct, non-invasive manner that does not require patient participation. Developed by a team of leading neuroscientists and healthcare professionals, Delphi MD is a scientifically validated, accessible, and fully automated system, providing a highly sensitive solution for the early detection of physiological brain abnormalities leading to stroke or dementia in any neurological clinical setting. So why wait? Delphi MD, Neurodiagnostics.
Hi, I'm Elche. I'm a former brain injury patient and I walk really badly, but with the Alinka I will have a go around the velodrome and I'm much faster.
Hi, my name is Soretta Herman, and I'm co-founder and clinical director at Layla Care, and I'm going to talk to you today about our business. So our leadership team consists of 4 of us, myself, our founder and CEO, Samer, our VP of Layla Therapy, Sharon, and our chief of staff, Kavya. I'm not going to describe all of our backgrounds, but you can take a look at the slide after and see that we have a diverse set of backgrounds that we bring that complements each other and helps us form a really strong leadership team. So at Layla, our mission is to empower people to take control of their mental health. And within the mental health sector, we work in this space where there's a lot of fragmentation, but also a lack of personalization. So within the various services in the sector, there's a lot of variation in things like quality, dependability, and wait times for different services. This means that the journey to get help is often filled with a lot of things along the way that leads people to give up or have negative experiences. So when people decide to access help, their symptoms are often feeling unmanageable. So they're already in a place where navigating care is not the easiest. Then they have to find care. So they often search the internet on their own or get general recommendations from family, friends, or their doctors. And online searches can direct them to either free or self-guided resources that may not be a good match to their symptomology, or listing sites that are still hard to understand and navigate, and where they may contact providers without understanding how to find a good fit in a therapist. So we often get the feedback that by the time they get to Layla, this was people's last effort before they were just going to give up completely on getting care because it's been so difficult to find or because of the experiences they've had along the way. So we try to give people a really different kind of experience and connect them to the right care for them in a warm and dependable way. So in our work, we focus on 3 things that we feel are core ingredients to help people become better. The first is starting with warmth and human validation. So when connecting with us, we take the time to learn about people, correct any misunderstandings, explain the process and different options, and make people feel really heard and supported, all of which helps to build hope for a better future, which research shows is really important for positive clinical outcomes in mental health. So we follow these 2 kind of foundational steps with connecting people to the right intervention that's most appropriate or clinically indicated for their situation. In doing this, we're biased towards 2 things, the first of which is personalization, and I'll talk about that in the next slide, and also care collaboration, so connecting with other people involved in clients' care. And we're currently focusing on primary care doctors and insurance providers in order to improve the quality of client care. So the way that we focus on personalization is by looking at 3 different things with every client who comes to us. So the first one is obviously clinical fit. So are we connecting them to a service provider or a service that's a good match for the symptom or symptoms that they're coming to us for? Then the next one, also very obvious, is logistical fit. So services being available in the province that they're in, the time that they want to access services virtually or in person, depending what they're looking for, etc. Then the third factor, which is a little bit different, is interpersonal fit. So this is if a client would like to be matched to a therapist who specializes either in their personal background or specific lived experience that they've had. We try to provide options for them based on these factors as well. So our track record to date, we've had a lot of great traction since launching in 2019. We've facilitated over 50,000 therapy sessions, have a network of almost 200 partner therapists, consistently receive really great client feedback, and are in 3 provinces and launching in a 4th very soon. So finally, here's our growth plan for the business. First, geographical expansion, so expanding to new regions in Canada to improve access to care. Second, collaborating with the broader healthcare system, so continuing with GPs and possibly expanding to things like hospitals. Expanding our specialized services and programs that address high needs and underserved areas, such as disability care and DBT programming. And finally, as we do all of this, continuing to build out our platform to improve quality and experience, both for our clients and therapists. So thank you for your time and for listening.
I'm Dr. Ramesh Khanna. I'm very excited to tell you about how we're changing how dentists all over the world will look at their patients every day. We're doing this through an innovative software subscription solution that leverages the power of AI and machine learning to drive precision care and advanced patient assessments with risk profiles on dental patients all real time. There's a huge problem that exists in dentistry today with inconsistent and misdiagnoses, with patients walking out the door leading to them having more pain and cost later and costing a dental practice up to $1 million in a lost revenue opportunity every year. We've created an innovative solution that brings the mind and the wisdom of 1,000 dentists to the center of the patient relationship through a risk profile, real-time insights and recommendations, and a compliant, consistent process for the dentist and dental team to follow with every examination on a desktop or any mobile device. We have a massive market opportunity of $9.6 billion, and we're hoping to penetrate 10% of the North American market in 6 years for an annual recurring revenue of $117 million with our monthly subscription model. We are the only solution out there that will be collecting all this type of data from end to end as a true source of truth company, from pre-intake all the way to what's planned and billed and sent to insurance. We've raised over $1.5 million to date, and we've launched our MVP to market to over 25 dental practices, and we have an amazing team of co-founders, core team, and a board of advisors that are filling in all the gaps to help us bring this vision to reality. I'd love to continue discussing this with you further.
LUC 101 is a digital therapeutic that uses familiar music to relieve agitation in people with Alzheimer's dementia. LUC 101 is designed to be used by caregivers to administer regular, directed sessions of music listening for their patients with dementia. To get started, caregivers pair any audio and wearable devices they have to a tablet. Then, caregivers answer questions about a patient's demographic history, diagnoses, and preferred music to receive a personalized playlist of popular music across several genres. LUC 101 calibrates its music recommendation based on biometric information about the listener, using both wearable and non-contact computer vision sensors. Caregivers have the option to self-report a specific mood or state about the patient before beginning their session. Patients listen to a tailored music session with engaging visual content. Patients or caregivers can play, pause, skip, or repeat any song during playback. The playback experience is designed to support interaction between patients and caregivers, maximizing engagement during the music session and reducing agitation overall. Caregivers can rate current or past songs heard during a music session, or to prevent songs from playing again in the future. Afterwards, caregivers can evaluate the session, as well as rate specific songs that were played during the session, and their efficacy toward agitation reduction for the patient. After multiple sessions with LUC 101, the system will learn more about the types of music that help each patient feel less agitated and will maximize song choice towards the therapeutic goal.
My name is Rustam Sengupta and I'm the founder of Tuk Tuk Care. We started this movement to really transform how we support each other in our communities, especially the vulnerable folks who are alone at home. So people are now living longer, healthier, and happier. But unfortunately, with family moving away and the world getting so complicated, people are also lonelier. And if you're not super digital yourself, then life has become harder, especially with your close ones not close. An expert study done in the US said that nearly $500 billion was spent last year on family maintenance. But I spoke to more than 400 families last year, and no one is satisfied. The care market right now is fragmented, dependent on few full-time caregivers with really low tech or no real tools for the families to manage their care ecosystems. To me, this doesn't make sense. No one right now is looking at the huge talent pool of the community around us. People like you and me who can help on demand. Just like Airbnb, we can all open up and be companions and do a little bit of errands, can't we? So here's Tuk Tuk, a safe and simple platform that offers family-like support to seniors and other vulnerable groups using data-enabled tools to match them with like-minded, verified people from the neighborhood. Someone whom you can trust and you'd want your mom to take along for the doctor's appointment, or your dad to help with the computer setup. the scope for us is endless. We launched the MVP in Vancouver earlier this year and found a strong product market fit, completing over 300 services in the last 4-5 months. We raised $700,000 last year and continue to grow with a lot of interest. But most importantly, what we are proud of is the hundreds of customers who've benefited from our work.
Supporting aging individuals is complex, and the fragmentation of care makes this complexity overwhelming. The Regional Geriatric Program of Eastern Ontario has teamed up with Care Team Technologies to provide both healthcare and community providers across the Champlain region with digital support to coordinate and manage their patients' well-being during this challenging time of isolation. The Care Team platform rapidly connects distributed care provider networks, enabling remote monitoring and support and collaboration between health, social, and community care. It brings the entire support system together around a clear and integrated plan of action. Care Team breaks down the silos and fragmentation that exist between care provider and provides a tool to share information across the continuum of care. It connects to your current electronic health records, enabling you to start communicating and collaborating seamlessly.
As a physician, you meet patients briefly in the clinic or in the hospital, and you always wonder, did the information transmit? Are they doing what is recommended? And you don't really know until the next time you meet them. The exciting thing about technology is that you can now support patients in between appointments and ensure the continuity of care, and that they're doing every day the best that they can in order to support their healthcare outcomes and experience.
Care Team's platform is designed to be intuitive and easy to adopt. Dynamic action plans keep everyone informed about your care needs and detail the next steps on your health journey. Use Care Team's role-based access to keep your support team in the loop and share relevant tasks and information. Connect directly to community resources. Send automated check-ins to keep up to date with your patient's condition, track their progress, and proactively respond to changes. Access Care Team's platform wherever works for you, on your smartphone, tablet, or computer, and use in your preferred language. Join our network of care providers and get started on Care Team's digital platform today and enable seamless virtual care during COVID-19. Unlock the future of digital health with Care Team.
Hi, I'm Allison Schreier, CEO of Zinnia TV and one of our 4 founders. 18% of family caregivers of people with dementia die before the person they're caring for. This statistic terrified me when my husband received a dementia diagnosis at age 47. Our kids were just 12 and 15. My husband's increasingly challenging behaviors and emotional flare-ups took a huge hit on my own emotional and physical health, and I needed ways to reduce the stress that his dementia had on all of us. There are over 12 million family caregivers supporting people with dementia just in the US and Canada. Most of them either occasionally or routinely place the person with dementia in front of a television or a YouTube stream as a means of giving themselves some respite and providing engagement for the person they're caring for. But these solutions are intended for people who can tell fact from fiction, follow a plot, and process audio and video intended for people with healthy brains. The solution becomes part of the problem. Regular TV can result in confusion, boredom, daytime sleeping, and increased anxiety. Our solution is a library of over 180 research-driven videos that are digestible by and engaging for people living with dementia. Featuring meaningful topics and accessible activities, Zinnia TV is what caregivers are looking for when they turn on the TV, but it works. More than engaging programming, it is a therapeutic tool that helps foster connection, lower stress, and reduce anxiety. In 2022, in US dollars, Alzheimer's and other dementias cost the US and Canada more than $320 billion, and that doesn't count the cost of care provided by nearly 12 million unpaid family caregivers, estimated to be valued at more than $272 billion. Worldwide, around 55 million people currently have dementia, a number expected to rise to 78 million by 2030. The Zinnia TV app for mobile devices and connected TVs is available on a subscription basis for $6.99 a month or $69.99 a year US. Our team is led by me, a former family caregiver turned dementia advocate with clinical experience, a former designer from Apple with an engineering background, a startup operator and business development professional with a successful exit, and a multidisciplinary artist with film experience. Testimonials from caregivers validate the efficacy of our product, which is also being tested through a 2-year research project with the University of British Columbia and Vancouver General Hospital. We have renewed licensing agreements and established partnerships with tech platforms serving the long-term care market. Pilot surveys from one of the largest senior living operators in the US showed that Zinnia TV overwhelmingly engaged their residents, helped reduce negative behaviors, and helped prompt activities of daily living. Our vision is to be a global, comprehensive caregiver support platform. Thank you very much.
My name is Matthew Rosado, and I am the president and founder of Prova Innovations. Prova is a medtech startup focused on building rehabilitative devices for children and adults with a mobility challenge. By promoting certain walking habits, we can reduce the forces on the joint known to advanced osteoarthritis in the knee and hip. This treatment approach is ideal for patients too young for joint replacement, but until now has been limited to facilities with an in-clinic gait lab. At Prova, we are changing the standard of care for at-home gait rehabilitation. This is Prova Innovations, and we are providing the next step.
Hello, I'm Cindy Robinson, the CEO and co-founder of Vessel Prosthetics. We have designed a unique socket system to empower amputees. Every 30 seconds, a leg is amputated around the world. In North America, most of these amputations are because of diabetes, which my co-founder and I discovered when we visited a diabetes clinic in 2021. There are many amputees that we met there, like Ed here, who experiences poor socket fit, where his leg changes size inside of his socket, giving him blisters. Unfortunately, this pain leads to half of all lower limb amputees abandoning their prosthetic altogether. Thankfully, Vessel has a unique solution. Our isoform socket is the only socket that can automatically adjust as Ed's leg shrinks and swells. With isoform, Ed avoids blisters so he can walk around all day comfortably and even golf. Vessel's automatically adjusting socket has a leg up on the competition. Adjustable sockets on the market rely on constant manual operation, making them inaccessible to amputees with poor dexterity or sensation loss. We are entering a very attractive market. Our total addressable market is the global prosthetics market of $8.3 billion. When we focus on American below-the-knee amputees, which is the space we'll tackle first, we see $617 million of revenue. We have already started engaging with the Veterans Affairs to ease our way into the industry. From there, we will sell into the Hanger distribution network, which represents almost a quarter of all clinics. Hanger has a close relationship with the VA, which is why they are next in our pathway. Together, these large distribution channels will give us the resources and foundation to sell to smaller networks and individual clinics. My skills as a biomedical engineer and my co-founder's skills as a clinical anatomist are extremely complementary. We strengthened our product development efforts by hiring our first engineer, and we continue to strengthen our business strategies at several accelerator programs. On our advisory board, we have Francois, the official prosthetist for the US Paralympic track and field team and an independent clinic owner, and Dean and Rachel, who each have previous startup success. We have secured $700,000 in dilutive and non-dilutive funding from a dozen sources, filed our first patent, and begun collaborating with the Veterans Affairs Innovation Network on product validation. Today, I'm asking for $1 million for our pre-seed round. If you have questions or would like to learn more, please email me at sydney@vesselpro.com. Vessel is the only company solving poor socket fit with a unique solution. Join us in helping amputees like Ed get reliably back on their feet. Thank you.
Hi, my name is Alex and I'm the CEO and co-founder of MindEasy. I was born and raised in Lebanon and moved to Canada 5 years ago. A couple of years after I moved to Canada in August of 2020, a huge explosion took place in Lebanon. Being so far from my family, I felt helpless. I was completely emotionally devastated. I had to deal with sudden grief. It was hard to sleep, to take care of myself. My body was constantly tense, and I just could not find the motivation to complete my day-to-day tasks. I was depressed and unaware. And I'm not alone. Just like the hundreds of millions of immigrants and minorities in North America, I felt like there were real cultural mismatches when dealing with mental health. I was uncomfortable talking about my issues. From where I come from, as long as you have food on the table and a roof over your head, you're supposed to be happy. It sounds great, but it's really not that simple. Because if you defy this narrative, you're seen as crazy. When I finally reached out for help, it was hard to find a therapist with availability, and even harder to find resources that understood the cultural grief that I was experiencing, or even tools in my own language. This lack of access is a serious problem for individuals and the companies they work for. Employees from diverse backgrounds often experience an increase in turnover, loss of productivity, and higher burnout rates. This all leads to businesses losing over $80 billion annually. And MindEasy is here to solve this global problem. We have built a comprehensive platform using front-end avatars to engage with users in a way that feels non-judgmental and comfortable.
Welcome. Take a seat and relax. This is MindEasy's guide on overcoming anxiety.
Bienvenue dans le guide de MindEasy sur le stress financier.
This exercise consists of saying the following statements to yourself.
Think of us like a digital therapist that supplements your mental health journey. Our platform is powered by our database of world-class culturally adapted best practices in mental health, delivered through the avatars. We have onboarded Fortune 500 companies such as EA Games are on track to onboard over 9 qualified channel partners, representing over $2 million in annual revenue for us. Over the last 3 months, we reached over 15,000 end users in 20 different countries and 17 different languages. We're a co-founding team of first-generation immigrant women with vast experience in the space. I've been building startups for the past 4 years, and my 2 co-founders have literally PhD-level expertise in multicultural therapy, cognitive science, and computer science. We're on a mission to enable mental health access to every single person that looks or doesn't look like us, that speaks or doesn't speak like us. If you're interested in our mission, we'd love to talk to you.
We decided to start PragmaClim because we wanted to be able to help patients see help faster than Gord had to experience and hopefully catch disease progression earlier on. I took a Bachelor of Science of Biology at St. Francis Xavier University, and I actually worked side by side with a Parkinson's patient for a year, and he was pretty far advanced, and it was kind of heartbreaking to see, so I wanted to be able to do something to help others that were suffering with the same condition. I met Gordon while doing my research, and he came to me with a brilliant idea to be able to help Parkinson's patients, and then our idea actually progressed into a full software which we've developed called PRIMS. It's a Parkinson's Remote Interactive Monitoring System. So in office, a clinician will actually run through an assessment using motor and non-motor data. So the way that the software works is the depth cameras are attached to the computer. The Parkinson's patient just stands in front of the camera, nice and easy, and does the tasks that the computer asks it to. They don't need to attach any sensors to the body, which makes it really easy for fine motor tasks that Parkinson's patients typically struggle with. At the end of all the tests, the software will actually rate the patient in real-time data and give them a score of where they sit on a Parkinson's scale from 0 to 4. This is able to give clinicians more data so that they can monitor patients over more time and also possibly adjust their medications if needed. Ever since I started taking a science degree, I've been really invested in being able to help improve people's lives, and Gord has become family, so I want to have that same connection with so many other patients.
I started off as an engineering student. Now I have transformed into a businesswoman. I was inspired to create the first prototype of Guided Hands by a woman living with a rare type of cerebral palsy. She was a talented painter, but then as her condition progressed, she wasn't even able to hold onto a paintbrush. So I wanted to create the first prototypes to give her back her passion for painting. Guided Hands is a mechanical assistive device that enables anyone experiencing limited hand mobility to write, paint, draw, and access technology through touchscreen devices. Guided Hands has a unique sliding system that promotes controlled and guided hand movements as the user holds a handpiece tailored to their level of hand impairment.
I have essential tremors. The more fatigue I have, the more the tremors present itself. Guided Hands, I feel, is something that every person who has hand problems really should have. I think it's a necessity for those of us. It helps you glide through the writing process. I could just put my hand in, strap in, and start.
Our overarching goal is to improve the quality of life of our customers, helping them to reignite their lost passions and stimulate their brains, and helping them regain their confidence and creativity, which end up contributing to their overall improved quality of life. AgeWell was able to connect us with mentors, advisors, and a whole bunch of different resources to help us in our journey. They actually helped us secure funding to create our first 50 prototypes.
Well, it gives you confidence. I would recommend it in a heartbeat.
Today, Guided Hands has been tested by more than 300 physicians, occupational therapists, neurologists, and people living with limited hand mobility across North America. Every part of my journey has just been amazing and inspiring, especially seeing the smiles on our customers' faces. It really inspires us to just keep on going and strive towards making an impact in millions of lives.
Wow, what an impressive lineup. I was particularly struck by the quality. I can definitely see how, Care Daily can have an impact in the world that we see with older adults, especially with their Spanish language. And mobility is such a big category, so a linker and their innovation in their walker was really impressive. And who would have guessed we'd see innovation in the world have right?
Absolutely. Dentistry, is one of those areas where you think about it, people living with dementia have an increased challenge of having good oral hygiene. So dentistry is extremely important, especially for all older adults, or all of us, but and another complication just sort of layers on top of it when someone's living with dementia. So having a couple dental programs in this cohort is fantastic.
And of course, solving toward all of the corollary problems with dementia, like agitation. So I think there was a company that could help quell down that agitation that an older adult might feel.
Mary, I don't know, can you pick one or two favorites in this cohort? Is it possible to pick and choose? Which one do you
It's really difficult to pick. I will mention a couple. So Zinnia, I was very impressed by the entrepreneur and her work with assembling the videos that could calm a patient with dementia. And the talent of that team was really interesting. We know osteoarthritis is a huge market. The boomers are 77 at the top and another 20 years after that. The boomers who are 77 at the top end, 30 years after that, are tipping into the time where there's bone density loss. So anything in the arthritis space, I think, is worth looking at. Diabetes. There were several companies that touched on the diabetes issue, which is a huge global issue. And I think Vessel Prosthetics was one of them. It was impressive. And there was a lot of attention to cultural difference. So Mind Easy, looking at the cultural differences and mental health. So there were too many to mention, I think, but exciting. and Delphi MD is another one. So I think it's very hard to choose because there were so many this year, Mel, that were great.
Great. Thank you, Mary. I thought you were going to pick the ones that came out of Berkeley. There were 2 of them there just because that's coming out of your backyard. But I agree with you. There's a lot that address things like diversity and things within mental health and in other areas. So some really important areas that have been addressed today. Anyhow, let's see if the audience agrees with you on some of your picks, Mary. As we speak, they are casting their votes for the People's Choice Award, which again comes with that $1,000 in prize money from our sponsor, AgeWell. Next up, 2 more showcases featuring our Spark and our Discover and Adopt programs. Mary, thanks again for taking the time to review our contestants. And as always, we really appreciate working with you and MFA to help advance technology for older adults. Thank you.
Have a great afternoon, everyone. This was really a wonderful, wonderful competition.